I am mad as hell. And if you're watching this, you should be paying attention, because this is not entertainment, this is not conspiracy, and this is not clickbait. This is about evidence-based medicine, public health failure, and the cost of ignoring simple science. What if I told you that 2 cheap vitamins and 1 B vitamin, available for pennies a day, could reduce autism, ADHD, miscarriages, severe infections, and deadly birth defects by 50% or more? What if I told you this information has been sitting in the medical literature for years? And what if I told you that instead of aggressively studying it, testing it, and educating the public, our system chose caution, inertia, and silence? I'm Dr. David Grimes, MD, MPH. If you care about pregnancy, children, public health, or evidence-based medicine, you need to watch this entire video. And before we go any further, if this kind of content matters to you, hit subscribe, hit like, and share this video. Because YouTube only shows this to people if you tell it this matters. Now let's talk about evidence. Evidence-based medicine, EBM, is not a slogan. It is not, trust the expert. It is not, because we've always done it this way. EBM means decisions are made using the best available scientific data, clinical experience, and patient values. It means we test instead of guess. It means we measure instead of assume. And it means no one, no doctor, no agency, no authority, is above questioning. In pregnancy especially, evidence-based medicine matters more than anywhere else in healthcare. Because mistakes don't last a year, they last a lifetime. And here is the first uncomfortable truth. Most pregnancies are managed with shockingly little nutritional testing. We routinely monitor blood pressure, weight, ultrasounds, but we often fail to measure things like vitamin D levels, folate status beyond a prescription, iron stores, thyroid function in a meaningful way. These are not exotic labs. These are basic biological inputs. And biology does not care about guidelines. Biology responds to nutrients, hormones, and genes. Now let me be very clear. This video is not medical advice. You should talk to your physician. Everything I'm discussing is about testing, discussion, and evidence. But silence is not neutral. Silence causes harm. Vitamin D is a perfect example. Vitamin D is not just a vitamin. It functions as a hormone. It affects hundreds of genes. It influences immune development, brain development, bone formation, inflammation, and metabolic regulation. And yet, vitamin D deficiency is common, extremely common, including in pregnant women. Why? Because most people do not get enough sunlight. Because diet alone is insufficient. And because official recommendations were designed to prevent rickets, not to optimize lifelong health. Avoiding rickets is not the same as optimizing neurodevelopment. And this is where the conversation usually stops, because medicine is uncomfortable admitting that minimum may not be enough. But the data keeps piling up. Study after study shows that better outcomes occur when vitamin D blood levels are above 50 to 55 nanograms per milliliter. Not 10, not 20, not technically normal, above 50. And before anyone panics, no, this does not mean megadosing blindly. It means measuring, adjusting, and monitoring. That's evidence-based medicine. Vitamin K2 enters the picture because biology is interconnected. Vitamin D increases calcium absorption. Vitamin K2 tells calcium where to go. Into bones, into teeth, out of arteries. This is not controversial. This is basic physiology. Yet K2 is almost never discussed in routine care. And then there's folate, vitamin B9, critical for DNA synthesis, brain development, and preventing neural tube defects. This is one area where public health succeeded, but again, we stopped at enough, not optimal. So now ask yourself this question, and I want you to pause on it. If these nutrients are this important, if deficiency is this common, if the stakes are this high, why aren't we aggressively studying optimal levels? Why aren't we running large randomized controlled trials? Why are parents left to figure this out on their own? This is where I start getting mad as hell. Because the absence of data is not an accident, it's a policy choice. And if you're finding this information useful so far, pause right now and comment below. Tell me if your doctor has ever checked your vitamin D level, especially during pregnancy. I read those comments. This video is long because the topic matters. And we're just getting started. Let's keep going. Because once you understand how important these nutrients are biologically, the next question becomes unavoidable. What happens when deficiency shows up during pregnancy? Pregnancy is not just about growth. It is about timing. Early development is a sequence of switches being turned on and off at precisely the right moments. When nutrients are missing at those moments, the body doesn't always get a second chance. Vitamin D plays a role in brain development very early in pregnancy. It influences neuronal growth, immune signaling in the placenta, and inflammatory balance. That matters because excessive inflammation during pregnancy has been associated with higher risks of neurodevelopmental conditions. This is not speculation. This is documented physiology. When vitamin D levels are low, immune regulation becomes less precise. The immune system becomes louder, more reactive. During pregnancy, that increased inflammatory signaling can affect the developing brain. That is one reason researchers have explored links between low maternal vitamin D levels and increased risks of autism and ADHD. Now let me be very clear, because this always gets twisted. Autism and ADHD are complex. They are not caused by a single vitamin deficiency. Anyone who tells you otherwise is lying to you. But risk is not the same as cause. When we talk about reducing risk by 30%, 40%, 50%, that matters. Because when you scale that across millions of pregnancies, the numbers become enormous. This is exactly how folate changed the story with neural tube defects. Folate didn't eliminate every neural tube defect, but it dramatically reduced them. That's what risk reduction looks like in public health. Now let's talk about vitamin K2 again, because this is where medicine often oversimplifies. Pregnancy increases calcium demands. The fetus needs calcium to build a skeleton. The mother's body adapts by increasing absorption. Vitamin D helps absorb calcium. Vitamin K2 helps place calcium correctly. Without enough K2, calcium can end up in places it does not belong, including soft tissues and blood vessels. This matters not just long-term, but during pregnancy, when vascular health is critical. K2 also activates proteins involved in bone mineralization. That means stronger fetal bones and protection for maternal bone density at the same time. This is not alternative medicine. This is basic nutrient synergy. And yet, how often is this explained to patients? Almost never. Now let's talk about safety, because this is where fear often shuts down the conversation. Every nutrient, every medication, and every intervention has a safety window. Vitamin D is no different. Yes, extremely high levels of vitamin D can cause harm. That is true. But here's the part that often gets left out. Toxicity occurs at blood levels far above what most people will ever reach, especially when supplementation is guided by blood testing and physician oversight. Fear-based medicine says, avoid the conversation entirely. Evidence-based medicine says, measure, monitor, and individualize. There is a massive difference between blind dosing and supervised care, and this is where one-size-fits-all recommendations fail. Two people can take the same amount of vitamin D and end up with dramatically different blood levels. Genetics, body fat, sun exposure, and absorption all matter. That is why testing matters more than dosage charts. If you take nothing else from this video, take this. You cannot practice evidence-based medicine without measurement. Now let's talk about miscarriages. Miscarriage is common, painfully common, and in many cases, no clear cause is ever identified. But immune dysregulation and inflammation are known contributors to early pregnancy loss. Vitamin D plays a role in immune tolerance, the ability of the mother's immune system to accept the developing fetus. Low vitamin D levels have been associated with higher miscarriage rates in multiple observational studies. Again, this does not mean vitamin D prevents all miscarriages. It means deficiency may increase risk, and correcting deficiency may reduce that risk. That matters. Small for gestational age babies are another example. When placental function is impaired, often through inflammation or vascular dysfunction, fetal growth can be restricted. Nutrient status plays a role here, including vitamin D and K2. Now zoom out for a moment. None of this is radical. This is how public health has always progressed. We observe patterns. We study mechanisms. We test hypotheses. We refine recommendations. So why are we stuck? Why are patients still told, "You're probably fine," without testing? Why are doctors constrained by outdated thresholds designed decades ago to prevent severe deficiency diseases, not to optimize outcomes? And why aren't governments funding the studies that would answer these questions once and for all? This is where frustration turns into anger. Because randomized controlled trials cost money, and nutrients don't generate patents. That means there is very little financial incentive for private industry to fund large, definitive trials on vitamins. So who is left? Public institutions, governments, public health agencies. And when those institutions fail to act, progress stalls. If you agree that this research should exist, pause the video right now and hit like. That matters more than you think. Now let's briefly talk about infectious disease, because this conversation exploded during COVID, and then was quietly buried. Vitamin D is deeply involved in immune regulation. Not immune activation, regulation. It helps the immune system respond appropriately, not excessively. Multiple studies showed that people with adequate vitamin D levels had fewer severe infections, fewer ICU admissions, and lower mortality rates. Was vitamin D a cure? No. Did it reduce risk? Yes. And yet, instead of saying, "This looks promising, let's study it aggressively," the conversation became politicized, minimized, or ignored. That should concern everyone, regardless of where you fall politically. Because if we cannot objectively study inexpensive, low-risk interventions during a crisis, what does that say about our priorities? This is not about replacing medicine. This is about complementing it with biology. And if this conversation makes you uncomfortable, good. It should. Progress comes from discomfort. Now let me say something directly to parents and future parents watching this. You are not irresponsible for asking questions. You are not anti-science for wanting data. You are not difficult for requesting lab tests. You are advocating, and advocacy is how medicine improves. If this video is helping you think differently, subscribe to the channel. I'm going to keep making long-form, evidence-based content that doesn't fit into 15-second sound bites. In the next part, I'm going to connect all of this to public health failure, policy inertia, and why we keep repeating the same mistakes, even when the data is staring us in the face. And I'm going to be very clear about what needs to change. Let's finish this by zooming out. Because once you understand the biology, once you understand the evidence, and once you understand how much is at stake, the final question becomes impossible to avoid. Why didn't this happen? Why didn't we see massive, coordinated efforts to study optimal vitamin D, K2, and folate levels in pregnancy, early childhood, and infectious disease? Why were these questions treated as fringe instead of urgent? And why, after decades of accumulating data, are patients still left to discover this information on their own? This is where science meets policy, and where policy often fails. Public health systems are very good at reacting to crises with tools they already understand. Drugs, devices, patents, emergency authorizations. They are far less comfortable with tools that are inexpensive, non-patentable, and dependent on prevention rather than intervention. Vitamins don't generate billion-dollar markets. They don't come with lobbying power. And they don't fit neatly into a prescription pad. That doesn't make them unimportant. It makes them inconvenient. During COVID, we saw this play out in real time. Vitamin D was not a cure. It was not a replacement for medical care. But the evidence suggested it could reduce severity, ICU admissions, and mortality. That should have triggered massive randomized controlled trials. Instead, the conversation stalled. And when research stalls during a crisis, people die unnecessarily. That is not politics. That is consequence. And here's the uncomfortable truth. Public health often operates on inertia. Guidelines lag behind evidence. Recommendations trail decades of data. And once a position is taken, institutions resist revisiting it, even when new information emerges. This is not unique to vitamins. It's a systemic problem, but pregnancy, early development, and childhood health are precisely where we cannot afford inertia. Because once development is missed, you don't get a do-over. Now let me say something clearly, because I know how this will be heard by some people. This is not an argument against medicine. This is not an argument against vaccines. This is not an argument for replacing doctors. This is an argument for better medicine. Medicine that measures. Medicine that updates. Medicine that isn't afraid to admit, we didn't know then what we know now. That's not weakness. That's science. And that's why I wrote my book. Not to scare people, not to sell supplements, but to put the evidence in one place, clearly, responsibly, and accessibly. The book walks through the biology, the studies, the clinical reasoning, and the questions patients should be asking their doctors. If you want to go deeper than this video allows, the book is available on Amazon. Just search my name, Dr. David Grimes, and the title focusing on vitamins D3, K2, and B9. It's written for patients, parents, and clinicians who want evidence, not slogans. Now let's talk about what you can actually do. First, ask questions. Ask your doctor if your vitamin D level has ever been checked. Ask what your actual blood number is, not whether it's normal. Normal is a statistic. Optimal is a goal. Second, understand that supplementation without testing is not evidence-based medicine. Testing matters. Monitoring matters. Adjustment matters. Third, demand better research. Large randomized controlled trials do not happen by accident. They happen when the public demands them and governments fund them. If you believe we should know whether optimal vitamin D levels can reduce autism risk, miscarriage rates, severe infections, and chronic disease, say that out loud. Say it to your representatives. Say it to public health agencies. Say it in comments, conversations, and professional forums. Silence is consent. Now let me speak directly to healthcare professionals watching this. If you were never trained on vitamin D optimization, K2 synergy, or nutrient-driven risk reduction, that's not a personal failure. That's a training failure. Medicine evolves, and staying current requires humility. We owe our patients curiosity, not complacency. And to parents watching this, especially expectant parents, you are not difficult for asking questions. You are not irresponsible for wanting data. And you are not anti-science for questioning outdated guidelines. You are practicing evidence-based thinking. If this video has helped you, do 3 things right now. First, subscribe to the channel. Long-form, evidence-based content only survives if people support it. Second, like the video. That tells the algorithm this conversation matters. Third, comment below. Tell me if your doctor has ever tested your vitamin D level, especially during pregnancy. Those comments matter. And if you want the full deep dive, the studies, the citations, the clinical logic, the book is available on Amazon now. Medicine should not be about fear. It should not be about authority. And it should never be about silence. Medicine should be about evidence, humility, and doing better when we know better. That is why I made this video. That is why I wrote the book. And that is why, after all of this, I am still mad as hell. Because we can do better. And now, we must.